Welcome back to the Better Health Now podcast. Today I'm sitting down with Dr. Joseph Forrester, board-certified allergist and immunologist here at Cullman Regional. Dr. Joseph Forrester attended medical school at the University of Health Sciences College of Osteopathic Medicine in Kansas City, Missouri, and completed his residency in pediatrics and fellowship in adult and pediatric allergy and immunology at San Antonio Uniformed Services Health Education Consultorium at Lakeland Air Force Base in Fort Sam Houston, Texas. During his military career, Dr. Forrester commanded over 130 personnel in a diverse and multi-specialty medical flight, served as a chief medical officer at the Air Force's third largest hospital, and held the position as chief allergy and immunology at Elgin Air Force Base in Florida for the last 12 years of his military career, retiring at the rank of colonel. Thank you for taking the time to sit down with me today.
Thank you, Clark. It's good to be here.
Yeah. So, first question: What ultimately brought you to Cullman Regional following your retirement from the Air Force?
Well, it's a good question. About 2.5 years ago, I really wasn't thinking about retiring from the Air Force. I was approaching 20 years of active duty, 24 years of total service. And one day I was sitting on the beach with my wife and a couple kids. We were living in Destin. I was stationed at Eglin Air Force Base in the Panhandle of Florida. And I got a text from one of my daughters who was working at Target. And it was a business card of a gentleman. He said, "This gentleman wants to talk to you." So I called the guy the next week and ended up, they recruited me. This was a different medical practice here in town. Recruited me to join their group after retirement. So my wife and I prayed about it, made the decision to go ahead and put in the paperwork and retire when I was eligible to do that. So I retired in the summer of 2023 and came to Cullman.
Wow, and Such a unique thing just to see a business card, someone to reach out. You're living in Florida. You really know? Did you have any ties to the Cullman area, to Alabama prior?
Well, not to Cullman, but I grew up in Haleville, Alabama, which is just west of here in Winston County, and that's where I was born and raised. I never thought I would come back to North Alabama. I wasn't opposed to coming back to North Alabama. In fact, I've always considered it home.
Yeah.
But we were quite happy on the beaches in Destin.
I bet.
I didn't think my wife would leave there.
Yeah.
So.
But I guess coming home, like you said, with having family close by,
Sure.
and as you getting to that opportunity to retire after your career in the Air Force, to then coming back home, where it's familiar, but it's changed a lot probably since you were last here.
It's changed a lot. I think I only came to Cullman one time growing up. For some reason, we never made the journey through the forest to come over to Cullman. But I remember Cullman being just a little two-horse town back when I was a kid. And when we came back and interviewed back in 2021, I was very surprised at how much it has grown, yet still feels like a small town. It has that down-home kind of feeling, much like Haleville, where I grew up.
Yeah. So with allergies affecting more than 50 million people in the United States, what ultimately led you to focus that throughout your whole career?
Well, I always knew I wanted to specialize. I wanted the opportunity, at least, to specialize in medicine. During medical school, I realized that in order to be a specialist, in most cases, you needed to either be a pediatrician or an internal medicine doctor.
Okay.
So I chose actually pediatrics, and I started out as a general pediatrician with the expectation that I would go back and specialize.
Okay.
I did electives as a third and fourth year medical student and really fell in love with allergy immunology during my fourth year of medical school. So that was always on my radar to do. I did my first tour as a general pediatrician in the Air Force. I was stationed at the Air Force Academy. And while I was there, I just realized, I'm not getting any younger. I should probably go back and do my specialty. So applied for the fellowship and was accepted. And the rest is history, I guess. But
how long was that fellowship to actually get that specialization?
It's a 2-year fellowship.
Okay. So you did your 2-year fellowship, you kind of fell in love with this, and you've been doing being an allergist and immunologist since then, kind of specializing in that.
That's what and my fellowship covered pediatric and adult allergies.
Okay.
So even though I started out as a pediatrician, some people know, some people don't, but in order to be an allergist, it's one of the few specialties that allows both pediatricians and internists to apply to the fellowship.
Okay.
So you have to be one of those to get into the fellowship. They're the only two primary care specialties that are allowed to train. But when you get into the training, most of the training programs in the country, certainly the fellowship I went to, covers adult and pediatrics. So
Okay.
internists have to get comfortable taking care of kids with allergies, and pediatricians have to get comfortable taking care of adults with allergies.
So the area that I wanted to kind of focus this conversation on today is allergy testing and the treatments that you recommend to your patients.
Yeah.
What does the overall process look like for a patient coming in to get tested for allergies, and what do those results typically show?
Okay. So if someone has recurrent, it could be rhinoconjunctivitis, so nasal symptoms, whether it be sneezing, itching, congestion, runny nose, stuffy nose, drainage down the back of their throat, itchy, watery eyes, whether it's seasonal or persistent. They've done some conservative or, kind of common sense things, whether they're taking some over-the-counter medications, but it's just not getting any better. They're not able to control it with conservative measures. Well, at that point, I think it's appropriate to come see an allergist. I'll spend a lot of time. I generally spend anywhere from 30 to 60 minutes with every new patient, going through their full medical history, going through the medications and the treatments they've tried before to determine which, testing is appropriate.
Okay.
If appropriate, meaning there's no contraindication to doing allergy skin testing, that's my preferred method. And that's where we actually introduce a small amount of different allergens into the epidermis, usually on their back.
Okay.
That has allergies, that has extracts, for, animals like cat and dog, the common ones. We can do other animals as well. Dust mites, feathers, roaches, trees, weeds, grasses, molds.
Wow.
All of those things we also can test for foods using skin prick method.
And it's
pricked
all on
into
the back,
skin.
you said?
Generally on the back, because that's where you have the most real estate. Because
Okay.
if we're doing 56, 65, however many we're going to do skin prick test. I try to not do more than 60 usually on an adult anyway. That's where we have the most real estate.
Yeah.
We can use the arms if needed.
Okay.
There are reasons for doing that. If someone has a lot of ink on their back, have a lot of tattoos. I've had patients like that where you can't see a reaction.
Yeah.
You've got to find use any available clear skin at that
For sure.
point.
And so does the process when is that first consultation typically not when the patient gets the testing, it's just kind of talking through their thing, or does sometimes they even leave that first day visit with you with the testing?
Yeah. My goal is to be as patient-centered as possible. And for me, that is providing them with all available information on that first visit. I hate having to keep them coming back to, see me one day, get tested one day, come see me for the results. That happens sometimes. Okay. And I understand in some systems that's the way it has to be. But my goal and what I try is to see them, test them, let them leave that day knowing what they're allergic to and with a treatment plan in place.
So does typically for most things that you're testing for, does it show immediately, or how quickly does the testing show the actual results if they are allergic or if they're not?
Within 15 to 20 minutes, we have the results for skin testing.
Wow. And so over the course of your career, I mean, you've had an extensive career. Like, what are some of the most common allergies that you see from your patients? And what are maybe some of the sort of more unique or uncommon things that you've tested throughout your career?
Well, certainly the common ones are, and it's going to be across the board. Animals like cat and dog, people's pets.
Yes.
They love them, but the pet dander doesn't always love them
For
back.
sure.
Dust mites are other common ones. Now, dust mites thrive in humid environments. So here in the South, we have dust mites, whether your house is squeaky clean or not. There are dust mites in the environment. So, and it's a perennial allergen, meaning you're exposed to it year round.
Okay.
And then, the common trees, oak tree around here is a big one. The grasses in the summer tend to be big allergens in this area. And where I was in the panhandle of Florida as well. We're not too far from Florida. So our allergy patterns here are not that different from what I've been doing the last 12 years at Eglin Air Force Base either. So those would be the common ones, and certainly food allergies. The 5 common food allergies are wheat, milk, egg, peanut, soy.
And all of those you can find out in 15, 20 minutes
That's
if someone's allergic to that
absolutely.
too. Wow.
I mean, it's got to be appropriate, meaning we don't skin test someone who has active or poorly controlled asthma. I'll do a blood test on them usually, or get their asthma under control and then complete the allergy skin testing.
Okay. So is the blood testing and the allergy skin testing are kind of the two main ways that you
Those
find?
those are the main ways
Okay.
that we test for allergies.
And I'm assuming the treatments too vary depending on the severity of those allergies and just what allergies those particular people have, because what the way that maybe a cat affects one person is not the same for the other.
Yeah, you're exactly right. I don't treat a test result. I treat the patient. So I've had patients who we tested them for 56 items, and 55 of the 56 come back positive.
Wow.
Their back lights up with one big hive, yet they had minor symptoms. Well, they don't need a lot of medicine. They may develop it later. It may help them to try and implement allergen avoidance measures, like maybe I don't need to let the dog sleep on my bed, or I need to get some dust mite encasements for my pillow, my mattress. Do some common sense things, but maybe they don't need to be on a ton of medicine. There are other patients who test positive to very few things, yet their symptoms are severe. So we can, we customize the treatment plan to the patient and the result. Try to put the two together to get them to where they're able to function, not miss school or work, and be able to feel good throughout the day. Yeah.
So I guess when the testing occurs, does the symptoms typically occur at the same time as those as it lights up and it shows that, hey, they might be allergic to that particular test? Does the symptoms come right after that too, or sometimes the symptoms are delayed?
When you say symptoms, are you talking about?
Or it's like if with an allergy to an animal, sometimes you have like the watery eyes or whatever it might be. Is when you're testing for that, do you see that right at the same time?
Well, ideally we won't.
Okay.
It is always a risk with allergy skin testing because we're introducing things into the skin that you are potentially allergic to. So there is a slight risk of a systemic allergic reaction, which would manifest itself as those symptoms you just mentioned. If I skin test someone and they start coughing or wheezing or having itchy, watery eyes or any of those symptoms, well, I'm now treating them for an allergic reaction. They're probably going to get an epinephrine injection. They're going to get some antihistamines.
Wow.
Now, the risk of that is well less than, it's about 0.03%
so it doesn't happen too often.
But that's why I don't test people who have uncontrolled asthma.
Makes sense.
So, and I don't test. There are certain medications that also preclude me from doing skin testing. But that's part of the history taking. It's an extremely low risk, but it's not zero. So I'm very risk averse. So
and so it seems like the career that you have it's making the lifestyle for your patients better every day.
Absolutely, that was my goal. I wanted one of the reasons I specialized. I loved general pediatrics. Don't get me wrong, but I was kind of the jack of all trades, right? But I was a master of none. I wanted to be a specialist in a few things. Yeah. And I also wanted to be able to offer definitive treatment. It's rare that you can do that in a non-surgical specialty, to offer a definitive therapy to change someone's immune reaction. And one of the therapies we have is allergy immunotherapy, where we actually can inject people with some of the things they're allergic to. And it's done in a controlled manner in a build-up process, but where we desensitize their immune reaction to the things they're allergic to.
Wow.
And there's a lot of data on allergy immunotherapy going back well over 100 years, and consistently it shows that at least 80% of people who complete an allergy shot, the allergy immunotherapy are also called allergy shots. 80% of people who complete at least 3 years of therapy will have an 80% improvement in their symptoms. And it tends to be lifelong. Even after we stop shots, once they've graduated from the therapy, they continue to have that improvement. So that's 80% decrease in symptoms, in medication use, in school and work absenteeism, and improvement in quality of life. And that's the expectation.
So is that therapy something that you've been doing throughout your entire career, or is that a fairly new form of treatment?
It's not new. Like I said, it's been around for well over 100 years. But allergists and immunologists are, there are some other specialties that do some types of immunotherapy as well. But allergists, that really is our bread and butter. That's what we do. And it's available for environmental allergies. There are some food allergy immunotherapy products available. We don't have it here. Most places that's available at like academic centers.
Interesting. Okay.
And not for a lot of foods.
Yeah.
Peanut, I think, is right now the only one that has a
Okay.
commercially available product. But for children before the age of 18, if they have a peanut allergy, we might be able to get them to a center where they would do that. Like I said, we don't do that in our clinic right now.
Okay.
Logistically, it's not possible.
Yeah.
But most of the time, I suspect an academic center nearby would be able to offer that to them.
For sure. So thinking through, everything that we're recording this episode at the beginning of 2024. If you were to see a news headline, an article come out about the work you're doing, here at Cullman Regional, that your colleagues are doing, what would you want that headline to say?
Well, maybe not so much about me, but about Cullman Regional in general. I think in my experience, it's fairly unique to have this size town with this robust of a medical center. When I spoke with the folks here, as I was talking about joining their group, I was impressed with their commitment to growing the medical specialties here in Cullman. We're located in a very strategic spot between Birmingham and Huntsville, right on I-65. Lots of traffic, easy access. So I would like to see Cullman Regional continue to grow in the pediatric and the medicine specialties especially. And one day, we be referred to as a center of excellence certainly for allergy and immunology, but I think all specialties, the potential for growth here and offering therapies to patients so they don't have to travel so far.
Yeah.
And, maybe they travel from those other places to us because
sure.
of the reputation we develop.
Yeah. Well, thank you for taking the time to sit down and talk with me today. Continue to look forward to the impact you'll have in your patients' lives while you're here at Cullman Regional. If you're listening and you want to learn more about Cullman Regional or any of the work being done here, you can visit our website, cullmanregional.com today. But thank you again, Dr. Forrester, for being here.
Thank you for inviting me.